Who is going to perform my hair transplant? Doctor or technician? Part 1 of this topic is going to be about the definition. So, what is a doctor doing a hair transplant? What is a technician doing a hair transplant? And the definition regarding the involvement or whether a doctor is involved in surgery and how much. So this is going to be part 1. Hair transplant surgery is a procedure that requires a team. It has to be multiple members. A hair transplant procedure cannot be performed by a single person, no matter the training background. So we have to understand, first of all, it requires a team. There's a lot of labor in this procedure. Takes many hours, frequently the whole day, sometimes even 2 consecutive days to complete a hair transplant. The nature of hair transplant involves the repetition of the same surgical maneuvers, small surgical maneuvers, but repeated thousands, sometimes tens of thousands of times. So this is quite unique to hair restoration surgery. So there's a repetition of the same maneuvers tens of thousands of times. So in a way, we need a robotic labor. There's even been some experiments in trying to invent robots which currently have not reached the skill sets of a human being, but that's because of the robotic requirement of repeating the same maneuver thousands of times. So, hair transplant surgery is obviously a medical treatment. This means that there has to be a responsible doctor. That's for sure. So there has to be a medical doctor in charge of these surgical procedures. Secondly, hair transplant surgery is surgery. Because it's surgery, ideally, the doctor in charge should have a surgical background. Now, frequently, the term hair restoration surgeon or hair transplant surgeon is used for doctors practicing hair restoration surgery, but oftentimes these doctors have no surgical background. That's a topic yet to be solved. I mean, there are hair transplant doctors who do not have surgical training. Anyway, so ideally we want a hair transplant surgeon, a surgeon who has surgical background in charge of the surgery. Now, the involvement of the surgeon in the surgery may be variable depending on the techniques used and the practical settings and even laws and regulations within each country. Now, since I initially mentioned that hair restoration surgery is a team's work, this team could contain multiple medical doctors, or it could include a doctor plus hair transplant technicians. I will explain that term later, in the team, or sometimes even in some countries and practices, only a team of technicians. So we have a team that could be set up in different ways. Now, a technician is anybody who's not a medical doctor. That means these could be health professionals other than a medical doctor, or these could be people who are not even health professionals, because in most countries there's no official licensing for hair transplant technicians. So basically, a hair transplant technician could be anybody who's not a medical doctor. So after defining that, let's define the steps of a hair transplant procedure and to compare various degrees of involvement of a doctor and technicians. So hair transplant surgery consists of 3 main steps. First part is donor harvesting. Donor harvesting means taking donor hairs. Okay? Now, taking donor hairs can be practiced in two different ways. It can be FUE, the initial harvesting of follicular unit grafts, which is the most preferred used technique nowadays, or it could be the strip method, taking out a skin strip and then dissecting it under the microscope to create follicular unit grafts. That's called donor harvesting. Okay. Second part is recipient site incisions. So that's creating small cuts into the recipient area so you can bring in and put the new grafts in. And third part is the placement of these grafts. Now, looking at those three parts, we could have different types of involvement of a surgeon. So, we could have a doctor-only procedure. Doctor-only procedure means the doctor doing all of these steps. Now, question is, what happens if a lonely doctor, a single doctor, tries to do all these steps? Now, since there's so much labor involved in hair transplant surgery, if a single doctor was to try and do everything, that would mean it would require many surgical days to complete a decent sized surgical procedure. I would say on average, let's say, it would take 3 to 4 days to complete a medium sized 2,000 to 2,500 graft procedure. If you wanted a large session like 4,000 or 5,000 grafts, I mean, it would take a doctor do it perhaps a week. You'd have to go through surgery every day for a week just to have such a large session completed by a single doctor. And as you can see, this is quite impractical. Well, could we have multiple doctors in a team? Theoretically, yes. But then this is also very impractical. Not only that it would be extremely costly, imagine, having to sponsor multiple doctors just to have one surgical procedure. I mean, it would be very impractical and costly. And I doubt if that practice exists anywhere in the world. But theoretically, that is doctor-only surgery. It's the doctor doing everything. And as I said, there are very few practices in the world, extremely expensive, also very, long, like taking multiple days to complete a hair transplant. Then we could have doctor involvement at certain degrees. Now that's the gray area. So, because the doctor being involved could be just drawing a line, or one step further could be doing some recipient site incisions. One step further could be doing all the recipient site incisions. One step further, it could be doing some donor harvesting as well. One step forward, it could be doing all the recipient site incisions. And the last step would be doctor only. So as you see, everything in between there's a doctor involvement, but there's a huge difference in the involvement of the doctor. And some believe like the whole procedure should be done by the doctor. Some believe the doctor should do all the incisions, including recipient site and donor harvesting. Some believe doctor should do recipient site incisions only, and some believe the doctor should do just the design and planning. But that's a debatable, and that's different everywhere in the world, and also from clinic to clinic. And obviously a technician-only surgery is when the doctor has no involvement and the technicians do the whole procedure. So I have tried to explain to you, what it is when you ask who's going to perform my surgery, doctor or technician. It's not just one answer like doctor or technician. The gray area is huge. So you have to understand all of that. You know, how that translates into quality is an entirely different subject. Or ethical and legal considerations, that's also a different subject. The goal for this video was just to define what it means, you know, whether a doctor is involved or not in surgery, technician and doctor and so on, and steps of the procedure.